Hello, and welcome to the Introduction to Anxiety module. We're going to be talking about anxiety, different ways to help someone manage their anxiety, as well as how anxiety manifests itself in the workplace. And I'll also be giving you resources towards the end of the presentation of different takeaways from anxiety and how you can use them to help someone in your life or a colleague who has anxiety. Like always, we will format this in following the 3 R's format. So when it comes to mental health and when it comes to these types of conversations, a lot of the times people are hesitant to get involved in these types of conversations because they think, well, I don't know if this person has anxiety or if they're just stressed out. And that is too high of a threshold to think about it. If you think about it, that's actually getting to the point of diagnosing, which is not what we aim to educate you on. All that we want to educate you on is how to just recognize that there might be something off with someone's mental health, and then what the next steps are for that person. So referring them to a mental health professional. And then we'll talk about how to relate to those in distress. So what are practical things you can do in the moment to help you connect with that person and get through to them and help them regulate their emotions a little bit better. So we're going to go ahead and get started with the first R, which is recognize. How do we recognize a mental health problem? In this case, how do we recognize that someone's having anxiety? Anxiety is a word that is often used in conversation, and it's a clinical term that is often used incorrectly. So to be able to recognize anxiety, we have to first understand, well, what is anxiety exactly? Anxiety is a mental health disorder characterized by feelings of worry, anxiety, or fear that is strong enough to interfere with one's daily activities. So a lot of the times anxiety and stress look similar. Stress is a healthy response to a stressful situation a lot of the time. So if you have a big presentation at work, you are going to be feeling stress, which is actually helpful because it's going to help you work harder. It's going to help you perform better. And that's completely a natural response to the stressor. With anxiety, it's a little bit different. A lot of the times people who struggle with anxiety can't pinpoint the why are they stressed, or the feelings, how their body is reacting and how their thoughts are reacting to the stressor is a lot greater than it calls for. And a lot of the times those individuals know and they can recognize that they're feeling a little out of control. Another important thing to know with the definition of anxiety is that it has to be strong enough to interfere with one's daily activities. So a lot of the times anxiety will come and go if this person doesn't struggle with an anxiety disorder. But with an anxiety disorder, it is strong enough to interfere with their daily activities. So maybe they're feeling too anxious to drive, or maybe they have social anxiety to a degree that they don't want to be involved in social activities anymore, or there's a specific type of anxiety where the individuals struggle to leave their house. So it's strong enough where that person can't show up in their life as they want to. So they can't show up how they want to at work. Maybe they're always preoccupied with their anxious thoughts, or they can't show up fully present at school. Maybe they're struggling to drive because they have driving anxiety. So it's actually to a degree enough where this person knows they're not showing up how they should be, and it's interfering with their daily life. So one of the questions that we get commonly when we talk about mental health disorders is, well, where do these mental health disorders come from? Is this something that someone was born with? Is this something that is caused by stress or difficult situations? And when we talk about what causes anxiety, it's actually a combination of a lot of different factors. So it's not always pinpointed to one specific thing, unless it's a specific case and that person has like PTSD about it or something like that. So what are the factors that cause anxiety? First one is a family history of mental health conditions, personality factors. So if this person has a personality that they like to be really organized, or they want to be the best, or they're very competitive, they might find that they have a lot of anxiety revolving their accomplishments and things like that. Stress can cause anxiety, substance abuse, and different environmental factors. So different situations this person might find themselves in. So what exactly are the symptoms of anxiety? And I'm sure you've heard of some of these, but I think there'll be some that will surprise you because they're not often associated with anxiety. So understanding the symptoms of anxiety. One is just feeling restless or on edge. So I don't know if you've ever had way too much coffee and you're feeling jumpy and irritable and you're just feeling super on edge. That is similar to the feelings of anxiety. Like I mentioned, feeling irritable, and then aches. A lot of times people don't realize that anxiety manifests physically a lot of the times. So aches such as headaches, muscle aches, or stomach aches are all really common of people who struggle or experience anxiety. A lot of the times children will feel more of the aches instead of those thoughts and their feelings. They will tell their parents, oh, I have a stomach ache, my head hurts, because that's how children will manifest anxiety and depression. Another big symptom associated with anxiety is panic attacks. And panic attacks don't only happen to individuals who have anxiety. It can happen to anyone, and they're very common. It's likely that everyone will experience a panic attack at least once in their life. And panic attacks are very uncomfortable because it's an abrupt surge of a lot of really uncomfortable feelings, such as trembling or chest pain. Many people actually think they're having a heart attack when they're having an anxiety or a panic attack because it's an extreme chest or extreme pain in their chest, and it's very uncomfortable. Many times people will feel really dizzy. They might feel numb in their hands or feet. They might tremble or shake. So it's a lot of very uncomfortable feelings all at once. And this is all paired with this feeling that I'm going to die. So with panic attacks, there's those physical sensations as well as the cognitive, so the thoughts, such as I'm going to die or I can't breathe. And that only makes the physical sensations worse, which makes the thoughts worse. And then it's just an ongoing cycle. So panic attacks, like I mentioned, they can happen to anyone. They are more common in those who struggle with anxiety. And there is panic disorder, which is someone who has reoccurring panic attacks, or that the thought of having a panic attack causes a lot of anxiety for them. So what are the different types of anxiety? So there's several different types of anxiety. Social anxiety disorder. This is someone who struggles to be social, who struggles to go out in public, and struggles to talk to people because they have fear of or they have anxiety of how they're going to be perceived. Separation anxiety disorder. This is common in children, as well as sometimes for couples. But this is, like, again, severe enough that it's interfering with your ability to function in your daily life. So it goes a lot farther than just missing someone. People get actually sick and they have body aches and a lot of uncomfortable feelings where they can't function normally with these disorders. Specific phobias, so someone who has a phobia of spiders or elevators or different things like that. It's something very specific, and the person isn't just scared of it. It's actually a very uncomfortable phobia where that person cannot tolerate being around whatever they have the phobia about. Selective mutism, this is something that happens in children, and it's when someone they struggle to talk. And so it seems like this person will not talk. It's usually in school-age children, and this is noticed a lot of the times by their teachers. And sometimes these children at home, they're very talkative, but at school or in public or in different activities, they just will not talk. They cannot talk. Agoraphobia, that's the one I mentioned earlier, where this person has a really specific fear of being out of their comfort zone. So they cannot leave their house, or it's very it's very distressing to them to leave their house. Panic disorder, I mentioned, it's someone who has extreme anxiety about having a panic attack and they have reoccurring panic attacks. And then the last one is generalized anxiety disorder. And generalized anxiety disorder is the most common form of anxiety. And anxiety is one of the most common, it is the most common mental health disorder. So this is, if you think about it, it's the most common mental health disorder is generalized anxiety disorder. So I'm going to spend a little extra time talking about that versus what I talked about on the other types of anxiety. So with generalized anxiety disorder, the anxiety is general. So this individual can't really pinpoint why they're anxious. It's just a general anxiety that exists in this individual's life. A lot of the times there's nothing to provoke it. Like I mentioned, it's interfering with this person's ability to function. A lot of the times they'll know that they are being over anxious or too stressful, but they cannot do anything to manage their anxiety. And like I mentioned before, there's a lot of physical symptoms associated with generalized anxiety disorder, such as fatigue, sleeplessness, headaches, muscle aches, muscle tension, sweating, shortness of breath, irritability, and hot flashes. So it's a very uncomfortable disorder to have, especially if the person isn't managing it with the help of a professional. So although it's the most common and it's very uncomfortable, it is treatable, and it's people find that throughout work, if they work on it, they're able to manage it pretty successfully. So if you or someone that you know is struggling with anxiety and struggling with these feelings, the best thing to do to be able to manage it and live a much more peaceful and enjoyable life is to speak to a professional. And we want to get those individuals to a professional before they're in a crisis situation. So when we're talking about referring individuals or ourselves, if we're interested in going to a professional, it's important for us to know the types of professionals that exist. So we have primary care doctors, and you might be thinking, well, why a primary care doctor if this is all mental health type of care? And it's because a lot of people get their mental health medication or referrals from a primary care doctor because it's the most accessible type of doctor. Most people already have their primary care physician. So that's one way that you can get some sort of support for your anxiety or your mental health challenges. Like always, the best type of mental health therapy or approach there is to treatment is a combination of therapy and medication if it's severe enough to require medication. And for the therapy, it'll be the counselors or therapists who do this sort of talk therapy. We also have psychiatrists on this list because counselors and therapists cannot provide medication. So it is very common for someone who is getting treatment for their anxiety to have a combination of professionals because they all do something different. Like for example, psychiatrists, they're not going to engage most of the time. They won't engage in that sort of talk therapy with the patient, while counselors and therapists can, but they cannot provide medication. So it's super common to have more than one professional on your care team for your mental health. And then hospital and treatment facilities, this is more for those extreme cases where that person really needs that critical and super specific type of help. But with anxiety, if the person gets to a professional and learns how to work through their anxiety before there's a crisis, that is the best case scenario for that individual to treat their anxiety. So other treatment options, we have medication and therapy, like I was mentioning. Not everyone who has anxiety needs to take medication. I always recommend for individuals to speak to their doctor about it. A lot of the times doctors recommend speaking to a professional for therapy and then trying medication. Just, you really have to find what's best for you or encourage the loved one in your life who has anxiety to speak to a professional and find what works for them. A lot of the times antidepressants will be prescribed for anxiety, even though you might think, oh, antidepressants, that's only for depression. But no, it can be prescribed for anxiety as well. And it does provide a really effective treatment once that individual finds what works for them, because everyone reacts to medication differently. And then, like I mentioned, psychotherapy. So that's that talk therapy done with counselors or therapists. So how do we relate to someone who has anxiety? What are different things that we can do to help someone who is struggling with anxiety? So these are 8 ways to help someone with anxiety. The first one is grounding. So grounding exercises. Those are exercises that are all about being in the here and now. So a lot of the times people will go outside and they will physically put their feet on the ground and on the grass and notice what's around them. There's a lot of different grounding exercise that exists. There's that 5, 4, 3, 2, 1 method that you can find on our YouTube channel and on other places on our site, which talks you through how to do a grounding exercise with someone. And essentially, you just encourage the person to tell you 5 things that they can see, 4 things that they can hear, 3 things that they can feel, 2 things that they can smell, and 1 thing that they can taste. And again, that is engaging the senses to bring that person to the here and now as a way to stop feeling so anxious and in that anxious cycle. Similarly, we have breathing exercises as resources at Gateway to Hope. 4 square breathing is one of the ones that we commonly use, but just encouraging that person to breathe and to do a certain type of timed breathing has been really effective for people who struggle with anxiety. The next one is to be empathetic. So if you don't have anxiety or you don't struggle with anxiety, it might be difficult for you to really understand what that person is going through. And you might unintentionally minimize their experience with this mental health disorder. So just remember, if you don't know much about anxiety, I encourage you to let that person inform you about their anxiety. Ask them how they feel, ask them how their anxiety manifests, if they found anything that helps, if they have anything that has been something to help them. Just remember that they're the expert in their own life. And if that's the best way that you can support them is validating their experience. The next one is to be patient. So working through anxiety takes a lot of times, and sometimes people find that it gets worse before it gets better. So you have to be patient with these individuals, or be patient with yourself if you're working through anxiety. Similarly to what I was mentioning before, you want to ask how they would like to be supported and get an understanding of their symptoms. So that's opening the channels of communication, opening the door, and encouraging them to inform you on the best way that you can support them, as well as understanding their symptoms. So anxiety is going to be different for every single person. So it's really helpful for those individuals to inform others. That way we know how to help them. They might say, okay, well, if I'm telling you I'm feeling anxious, the best thing that you can do is just sit with me in silence and not ask about it. Or maybe they would like for you to ask about it. It's just going to depend. And this type of conversation is really helpful because you're being empathetic, you're being open, and you're really just trying to see the best way that you can support them. And you'll find that that person really appreciates that. You also want to encourage healthy habits. So exercising helps people manage their anxiety, limiting caffeine, not using substances, so eating healthy. So all of these habits that we all know to be good for our physical body are also really great for our mental health. So making sure that you're encouraging healthy habits is going to be helpful for that person's mental health as well. And then lastly, educate yourself on anxiety. So things like this video, other resources online, just so you understand anxiety and you can play your part in destigmatizing anxiety and realizing that it's something real that people experience. I mentioned these grounding and breathing exercises. So the grounding method that I mentioned is the 5-4-3-2-1 method. Another one is to play a game. So asking that individual questions that have a lot of answers. So for example, you could say, tell me as many states as you can think of, or as many cities, as many colors. So something that's super accessible for that person to just think about. That's another way to distract them from their anxiety. And it can, again, help them bring themselves to the here and now. And breathing exercises, we always recommend 4 square breathing. So that's when you breathe in for 4 seconds, you hold for 4 seconds, exhale for 4 seconds, hold for 4 seconds, and you repeat that several times. You can walk the person through that exercise. You can do it yourself. But I will say the more you do it, the better it works. So I invite you to try the breathing exercise when you're feeling really regulated, and whenever you're feeling really anxious or stressed out, use the exercise and you'll see that you'll feel a lot better about it because you've been practicing. So breathing and practicing breathing, not only when you're anxious, helps make breathing exercises a lot more effective. Psychoeducation is basically the process of healing through education and learning about the condition. So this is not only beneficial to those who struggle with the condition, but it is also beneficial for their families, because it helps them understand how to cope with the disorder, and it helps interpersonal learning, and it helps the individuals have a structure of how to support someone. So for example, things like this course is part of psychoeducation. It's just learning how to support someone or learning how to support yourself if you struggle with anxiety. So for this module, for the anxiety module, these are 3 resources that you can access. We have a fact sheet on anxiety. So some quick facts about anxiety, such as that anxiety can have physical symptoms or the benefit of exercise on anxiety. This has a lot of information about anxiety, and it's a fact sheet that you can print and provide to anyone who needs it in your family or in your circle of loved ones. We also have a relate sheet. So the relate sheet are practical things that you can do to help someone with anxiety. So on here we have grounding and breathing, the habits, little challenges that you can do, specifically how you can help anxiety in the workplace. So that's a really helpful sheet on how you can, on practical ways to improve anxiety in the workplace. And then finally, we have a blog. So it's all about recognizing anxiety in the workplace. What does anxiety in the workplace look like? But you will find that it helps outside of the scope of workplace as well. So those are the 3 resources associated with anxiety. You can print them out. I really recommend that you look at it. They're very helpful. And best of all, like I mentioned, it's practical tools that you can use today to improve your anxiety in the workplace or even outside of the workplace. Another resource is the Hope Line. So this is a number that you can call from 5 to 8 p.m. and you can receive free 30 minutes of peer support counseling. They also can help you get a referral. So if you specify what you're looking for in a professional, as well as your insurance and your zip code and other criteria, they can help you get in contact with that person, because it can be very overwhelming, especially if you're dealing with mental health issues, to do that search and vet the insurance and all of that process. So it's a good resource if you find yourself in that situation. You don't have to just be in Houston to call this number. So if you have someone who would benefit from this number and they're in another state, you can share this information with them as well. Other resources that I want to talk about is our website. Our website has a lot of information on mental health just at your fingertips. It can be really overwhelming to just search anxiety in Google. So if this is a really good place for you to go and just learn about treatment options, what the symptoms are, and things like that. And that information can also be found on our app. The app also has other mental health resources like videos and guides and PDFs. You can also access trainings on the app. And if you are a mental health coach or mental health champion, you have special access within the app. So happy to answer those questions. If you have these specific type of questions, this is my contact information. Again, I'm Carolina Vargas. My colleague Mariana is also available to help with any questions, and that is our contact information. Again, here's our contact information. We are really happy to help. So just shoot us an email if we can provide any support on today's webinar, on the other webinars, or anything like that. And then finally, follow us on social media. We have a lot of free trainings for the community. We have a lot of different events. We release a lot of resources and blogs and videos. So if you are interested, please follow us on Facebook, Twitter, Instagram, YouTube, and LinkedIn. Just Gateway to Hope. I think our Instagram is Gateway to Hope GTH. But please follow us so we can stay in touch. So that's it for the anxiety webinar. I hope you found it helpful. And like I mentioned, please reach out if you have any questions. Thank you.